This video will continue our introduction of the GoLab CIPFA Value for Money or VfM Toolkit, this time with a focus on the Quantitative Calculator tab. Let's get started. So the previous video walked through this tab as well as the other tabs in our official blank version of the toolkit that you can fill out yourself. But for the purposes of this video, we've also prepared a case study, which you can also download at the same place you download the toolkit. And I think it's a little bit easier to walk through this quantitative tab when you have a case study that you can think through. So in this case, the project that we have filled out is a hypothetical version of a social impact bond, an outcome payment type of contract that's focused around a mental health counseling project for the youth that helps to both improve their mental health and also improve their life situation and keep them off the street. So this has a lot of different benefits, both to the participants themselves and also to the community around them. And this toolkit helps you to gauge what sort of costs and inputs there are and what sort of benefits you might receive. So for this project, the cost drivers have several different types. You have the sort of standard costs. So these might be costs that are independent of the outputs and outcomes. In this case, maybe you have management staff. There's 3 of them paid an annual salary. You have some outreach staff outreaching to the possible participants. You have maybe some counseling. Maybe in the second year, the counselors are relevant. And then maybe you also have to pay 2 years of rent in order to basically house this project. So those total costs in years 1 and 2 would add up to almost £140,000. But the more important and the bigger part of your costs in this type of outcome structure is actually output and outcome payments. And these categories are actually created from a drop-down menu of, given the sort of inputs that you have and the type of participants and the count of participants that you have, how many outputs and outcomes you're actually likely to get in this project. And this will help you to understand what you might be paying for in outcome or output-based payments. So in this case, you would take a drop down from the below section on outputs and fill out essentially which output is relevant that you're likely to pay for. It will automatically populate how many of those you're likely to have and tell you what your likely costs are from those outputs and outcomes. Now, moving on to how we actually calculate those. So how would you maybe calculate how many referrals you would get? In this case, a referral is just based on the number of participants that are likely to be engaged in the program. And so we have some automatic formulas that will tell you that in this case, given the number of people there are and what type of inputs you have, you're likely to get 76 people referred to the program in the first year, let's say. In that case, that would then feed back up to here. So you pay per referral, perhaps at £50 per referral, and it feeds up in that way. Maybe there's a different output, which is people enrolled in counseling in this case, because it's a mental health counseling program. So maybe you have 2 different kinds of counseling. One's called MST, one's called FFT. You can actually put in a different input for each year so that it will give you the net present value of the output valuation. One thing that's important to know is that you have to be clear in this toolkit what you value each thing at. So you need to know the per unit costs. So perhaps that's per year salary, or maybe it's per outcome payment. And you also need to know your internal valuation of what those outputs and outcomes are actually worth. So this is really important and helpful for you to know what is the program that you are doing, what are the inputs, what are the outputs, and why are you doing those outputs? Why is it something desirable? And what would you be willing to pay for that? Next is effectiveness. So this is focusing on outcomes. Let's say that this therapy program results in people being out of care after this type of therapy. So this basically keeps kids or youth in a more desirable housing situation. In that case, perhaps we value that at £100 per week, and there are 52 weeks in a year. Given a certain type of conversion or success rate, we predict that your inputs are likely to give you how many is this? 1,000 weeks of youth that are out of care that would otherwise have been in care. So that's pretty substantial, and that gives you a lot of benefit for your program. Perhaps another outcome would be that that you have budgetary benefits. So let's say that otherwise those youth would be in a less desirable situation that perhaps creates a lot of other unfortunate outcomes for the community. And when you have this type of outcome where you're keeping kids, these young people, out of care, keeping them maybe healthier and less likely to have bad outcomes in their own lives, you're also having a lot of savings for your community. And you can actually reflect that in this toolkit. So in this case study, for example, we have education savings, employment savings, and we've calculated that per week, perhaps the education and employment savings is about £105 to the community or to the council. Well, you can actually see that if you have a 30% success rate, then you're likely to have about almost 1,200 weeks of savings of this type in the first year. So that would be super helpful for you to really understand what is the impact, the budgetary impact of your community on this project, or on your community of this project, and also allows you to really put a valuation on some of these things that maybe you might struggle to measure, but that are very valuable for your community. And this can actually help you to predict how many of those are you going to get, and maybe what would you want to value them at. Really think through that more concretely so that you can really assess the value for money of your project. Then finally, we have a section on equity. So this is trying to get you to think about what are some different equity metrics that might be important for your project. So perhaps, in this mental health counseling, you want to reach a certain number of beneficiaries who are from the very poorest households in your community. And maybe you would set a goal of 80% of your beneficiaries are from that. Well, you can put into this calculator that you would like to be at 80%, but you project that the project will be at 70%. Well, that gives you a basically achievement rate of 88% on that goal. So what you can do is put in all the different equity metrics that are important to your project. You can think through them with your team. You can maybe put them in from different guidelines that your local authority has already put together. But generally, you put in these metrics and then you put in your projected value. So what do you really think you're going to get? And it will output based on the weightings that you put in of how important you think each factor is. It will output a weighted equity metric that's a percentage of essentially how close are you projected to be to your equity targets. And it will help you kind of identify if you might want to reweight some things, or if you want to really target a certain type of beneficiary for your program, where you might need to change some things in order to really get that done. So that is all of the different parts of the quantitative assessment calculator. It's part of the larger value for money toolkit that the Go Lab has put together with CIPFA. So if you're interested in this or in the toolkit more generally, there's another video, and you can also refer to some links in the description for more information, including a handy written guide that we've prepared. So thank you so much for watching this, and I really hope it's helpful.